Hi everybody, Dr. Terri DeNeui here, founder of EVEXIAS Medical Centers and EVEXIAS Health Solutions. And I'm here to talk to you today about leaky gut. Now, leaky gut is something I've been treating in our practice for several years now. It wasn't real trendy of a term when I first started researching and understanding this through my functional medicine training and integrative medicine training, but now it's kind of a trendy term because of awareness. And it can cause so many things we don't realize. So I just want to talk to you a little bit about it today so you can kind of have a better understanding. So leaky gut, so this does not look like an intestinal tract, but that's what it is. So in the inner intestines, there are these tight junctions that have what are called microvilli, and that's what these little things are, that actually take the food, proteins, and the nutrients from our food, and when they're working properly, they're coming through here and they're getting processed, and then they come through here and they get to the bloodstream and everything's great and everything's fine. Well, what happens when you have intestinal permeability, meaning those tight junctions are open, so food, proteins, and toxins and other things from the environment get through. So this is an example of one of those tight junctions, has a little opening in it, and foods and other toxins get into the bloodstream and cause a lot of problems. And these are problems that many patients go to their primary care provider with every day that they just can't find an answer to, and they're told everything is normal, you don't have any issues. And that's a very unfortunate statement that a provider can make, because if a patient says there's something going on, there's something going on. So if you've heard you're normal and you know it's not, I would encourage you to find a provider that can help you dig and find the root cause of your symptoms. But with leaky gut, what happens is those food proteins get into the bloodstream and cause an autoimmune reaction, can cause nutrient malabsorption. So maybe you're taking supplements orally and you're not feeling the effects of them, and that's because they just can't get into the bloodstream to get into the cell. So IV nutrition while you're healing your gut is a really good idea. Autoimmune issues, this is what we see the most of with leaky gut: Hashimoto's, psoriasis, eczema. I have a patient who knows he has leaky gut, knows he has sensitivity to gluten, doesn't want to give up his beer, so he's just decided to deal with his psoriasis on his elbows because he doesn't want to give up his beer. Okay, that's a choice, but once you know there's a cause, all the topical creams in the world you can get from a dermatologist isn't going to help it until you get to the root cause. Food intolerance, so things that patients complain of when they have leaky gut is bloating, gas, IBS, constipation, diarrhea, all kinds of GI issues after every meal when it gets really bad. But early warning signs are having those symptoms after a meal with inflammatory foods like gluten, pizza, breads, pastas, spicy foods, things like that. And another big one, and I see this quite a lot, especially adult ADD. I'm air quoting that because I think that's overdiagnosed, but we see that there is a blood-brain connection, that these toxins that get into the bloodstream cross the blood-brain barrier and cause depression, anxiety, so many things, ADD symptoms as well. So a lot of children have GI issues and gluten intolerance that have been diagnosed with ADD. They really don't have a chemical imbalance, they have a gut imbalance. And then of course inflammation. So I talked about the symptoms of leaky gut. Sometimes the symptoms of leaky gut are just depression and you can't figure out why, right? So I explain all of this because there's a lot more to the conversation than this, but if you are having some vague symptoms that you don't know what the root cause is, it could be your gut. And the way you heal your gut is many ways, but you have to to remove the offending foods. You have to repair your gut, and there are a lot of great things to repair your gut. I love, we have a product called GI Guard. There's another product that we use with Metagenics called Ultra GI Replenish. That's a medical food. There's some really amazing medical foods that you can utilize to heal the gut. Also, you need good probiotics because you got to work on the gut microbiome, which is another conversation for another day. But you can heal it, you can repair it. I have had patients be able to go off ADD meds, go off antidepressants, stop taking all their steroids for their skin disorders, so many more things. If this is something that you think you might have an issue with, please visit our website and contact one of our providers.